So when the announcement was made about the first case of Covid-19 in South Africa, what went through my mind was whether we in the Western Cape and as the Department of Health, whether we were prepared and adequately, appropriately geared to actually manage the pandemic in the Western Cape and as a department. Today, 1 year later, I can honestly say I'm so proud of how the department has managed the pandemic. I think we have really outdone ourselves. I think we were so flexible and responsive to change. Okay, we were so innovative in the way that we did things. Things happened very fast. Okay, and also we managed to get through 2 waves of the pandemic really well. With great teamwork, we were really resilient in the pandemic. Also, we're now at the point where we're rolling out the vaccine to all our healthcare workers exactly a year later, so March 2020 to March 2021. So we've come a very long way. As a healthcare worker and as a doctor in COVID-19, it's very difficult. And it's making those decisions difficult decisions about, who needs to be admitted, who needs to get this bed, who has a good prognosis, who doesn't have a good prognosis, which families do we need to now have more intense conversations with. And then also, what happens when they lose their loved ones. So now you've also got to provide them with that, emotional support, mental support. It's difficult. So this was the most death that I dealt with, I think, as a doctor. I don't think I've ever come across or being in a situation as tough as this. We had a lot of people, die in front of us, die a few hours of being admitted to hospital, dying in their homes. With COVID-19, it wasn't just the loss of elderly people or the loss of high-risk people, but there was a large portion of people who were also young people. So I think it was a time where I felt quite helpless and powerless. But also just trying to remind myself that we are doing the best that we can in a very resource limited setting.